infectious disease news that I've come across. So, first, going to start with a CDC level 2 travel alert for polio. This has to do with the fact that there are many parts of the world where there are vaccine-derived circulating polio viruses. These are remnants or mutations of the Sabin oral polio vaccine that have mutated, have recombined, and do have the ability to cause paralytic illness. So CDC's recommending level 2 travel alert, which means enhanced precautions, make sure you're vaccinated against polio when you go to this whole slew of countries, which includes places in Europe, in Asia, in Africa. So this isn't something that is just restricted to one part of the world. It is a lot of places that have circulating polio viruses. Some other things I want to talk about is the CDC again. The CDC has an acting director right now who's also the director of the NIH, and he's got quite a reputation for having specific views about the handling of the COVID pandemic. And there's a concern that his positions on the COVID pandemic may color any future pandemic response if he's in charge of it or if he's in power. And there's concerns about that because of certain positions he's taken that might not necessarily be orthodox or may not necessarily be completely science-based and are tied up with a lot of the politics that happened during COVID. And remember, the next pandemic, and this is a point that was made by the Bloomberg journalist Jason Gale, who's got a new book coming out, which I'll probably talk a little bit more about in the coming days, that says that he says that the new pandemic isn't going to announce itself. It's going to be unexplained pneumonia, unexplained hemorrhagic fever, unexplained sepsis that are occurring that herald a novel infectious disease threat. And that could be happening at any given time. So you have to really have a proactive approach that's not colored by biases, that's not colored by animosity towards how the last pandemic was handled. And there were pluses and minuses to that pandemic response. And I think it's really important that people look at this with fresh eyes and not be kind of encumbered by what they thought were shortcomings from COVID. It's important to know those shortcomings and overcome those shortcomings, but they shouldn't completely color your response to what might be the next infectious disease emergency. And speaking of that, we recently had a Senate hearing for a Surgeon General nominee named Casey Means, and in that hearing, she couldn't bring herself to actually endorse the measles vaccine wholeheartedly in the midst of measles outbreaks all over the United States and the U.S. on the brink of losing its measles elimination status, which really speaks to a problem that we have with thinking about infectious disease emergencies in the current era. In another infectious disease emergency that's kind of a slow-moving emergency from the human side is avian influenza. But interestingly, in the last week, there's been 20 different detections of H5N1, including at live bird markets. So these are places where birds are sold. They may be butchered there as well, in Florida, as well as in New York. So this is something that still continues to spread, continues to pose a risk, even though it's not necessarily in major headlines. A couple of other interesting things I'm going to mention. One of them is that when you think about respiratory viruses, there's kind of conserved immune responses, or the way they interact and make us sick, and the way the immune response might be directed against all of them can be somewhat non-specific, even though there's a specific response with antibodies and everything that's one for COVID, one for flu, one for RSV, whatever it may be. But there's a non-specific response. And there are people working on vaccines that are kind of universal in the sense that they non-specifically stimulate your immune system in order to block infection or to attenuate or lessen infection with multiple different viruses. And what researchers are doing is borrowing from another vaccine, one against tuberculosis that's not used in the United States, called BCG, which is known for having a non-specific immune stimulatory effect, meaning it revs up your immune system against everything when you get the BCG vaccine. So they're trying to mimic that with the nasal spray vaccine. That might be something that could lead to more universal vaccines for respiratory viruses and non-specific and universal down the road, several years down the road. And in speaking again back to the pandemic, one of the long tails of the pandemic is the disruption that's happened in medical care. And one of them affects another infectious disease, tuberculosis. So when the pandemic caused disruptions in care. It impacted tuberculosis in terms of, were people being diagnosed with tuberculosis? Were people being put on treatment for tuberculosis? Were people with symptoms coming to doctors with tuberculosis? And we knew that that was going to be a negative impact of COVID, because tuberculosis is one of those kind of high acuity infectious diseases, meaning in the sense that it's high acuity and it's deadly. It's the number one infectious disease killer, but also high acuity in that it also needs a lot of healthcare provider contact, and that was clearly disrupted. So there is a lot of data now showing that the pandemic is going to lead to, and has led to, and will continue to lead to, excess deaths from tuberculosis because of that disruption that occurred, which was predictable. Infections also have this role with causing frailty. So frailty is this concept we talk about often with elderly people, debilitated people, where they are basically unable to do their activities of daily living, where they're kind of on a tenuous precipice, and can really be pulled back into poor health with just a minor type of insult. And those people are more susceptible to those types of minor infections and other problems that might lead to hospitalization and eventually decreased lifespan. What we are now finding out is that infection increases frailty. We knew that frail people get more infections, but it also goes the other way, that infections increase frailty, likely by immune stimulation and inflammation from the immune system. So if you are getting infections, you are more likely to become frail. So this really underscores the need for infection prevention in those who are at risk for becoming frail. I wanted to mention some stuff about antibiotic resistance. We've talked about antibiotic resistance in the past as a major public health threat. Interestingly, a new antibiotic is being developed, but it's not really a new antibiotic. So there's an organization called GARD-P, or the Global Antibiotic Research and Development Partnership. And what they've done is found an animal antibiotic that's part of a class of antibiotics we use fairly reasonably or fairly frequently in the hospital, called aminoglycosides. But this aminoglycoside that's used in animals, apramycin, has not been used in humans, and it's distinct chemically enough that the resistance mechanisms don't cross. So they are trying to develop this animal aminoglycoside for use in drug-resistant infections. Obviously, aminoglycosides, for my clinical viewers, they have their own side effects and are difficult to use, but more antibiotics is usually always a better thing. Long COVID. Long COVID, again, umbrella term, mystery. We don't quite know exactly why people get it. We can't specifically diagnose it. We don't have any good treatments for it. And one other treatment has now failed. That's metformin, which is a diabetic drug, which is kind of a cure-all that has lots of effects beyond its diabetic effect. It doesn't seem to work in long COVID. There was hope that it might work in long COVID, but it doesn't. And one other thing about long COVID, increasingly learning about risk factors for long COVID, and one that's not so surprising is that individuals with pre-existing asthma are more likely to get long COVID. I think we know that there's an interaction with underlying illnesses, especially respiratory illnesses, as many people with long COVID have respiratory symptoms that persist. Infections in neonates. If a neonate, someone that's just born, gets meningitis, 8 times increased risk of intellectual disability. This really speaks to the fact that prenatal care and perinatal care needs to be better, because these types of infections are devastating, and that's why it's really important for women to be checked for certain infections during pregnancy, to not have a precipitous delivery, to not have deliveries that are complicated by infections or deliveries that put a neonate at risk for infection, because the consequences can be long-standing. It's not just a simple infection. I think that's all I have for today.